Hi, I'm Dr. Kevin Cheng, founder of Osana, a health service dedicated to transforming lives through prevention. Over the years, I have reflected with colleagues on what we wish people did so they can avoid pain, surgery, or developing a chronic disease. Often the answer lies in embracing a proactive mindset and putting healthy lifestyle practices into action. By doing this, the upside is not only better health, but also saving us time, money, and stress in the long run. In this podcast, I'm joined with my friend Saxon Piggott to chat with a new health expert each week. We'll cover practical ways to look after ourselves, how to prevent illness, and ways we can be inspired to live well. Welcome to Prevention Hacks, the weekly conversation where we go to health experts for advice, so you don't have to. Welcome to Prevention Hacks, and today we've got Rosemary Clancy. Welcome, Rose, to our podcast. You're a clinical psychologist with the Sydney Clinic, also a sleep psychologist with Sydney Sleep Centre, and you're a director of Let Sleep Happen, which is a great website with lots of online resources and services. So welcome, Rose, to our podcast. Thank you so much for joining us.
Thank you for having me.
So let's maybe start with, what is the sleep challenge for Australians? Is there, as a GP, I hear sleep and not getting good sleep, perhaps insomnia, sleep issues such as sleep apnea being quite a common issue. At a macro level, do we have an epidemic of insomnia, particularly during a pandemic?
Look, and at any given time, even without a pandemic circumstance, it's said that the rate of insomnia can be as high as 48% of the population, depending on the criteria used for diagnosing. So, but during the pandemic, there's been a number of studies done and around various countries that are suggestive that there's been quite an upswing in insomnia because of, especially during COVID isolation and fear about the unknown and fear about the future. So, I mean, for instance, Charles Moran, the Canadian researcher, and Julie Carrier were reporting in June in Sleep Medicine Journal about 5,400 adults whose sleep was self-reported for the first few months of COVID, and then they were also asked to self-evaluate the sleep in the last 3 months of 2019, and they were suggesting that 37%, there'd been a 37% increase in the rates of clinical insomnia from 14.6 to 20% in that population from before to the peak of the COVID pandemic. So especially healthcare workers with even higher rates of insomnia, 34 to 36%, anxiety and depressive symptoms up to 50% there, amongst healthcare workers in relation to the general population. It's really with symptoms of anxiety, depression and sleeplessness worse amongst frontline workers.
Right.
Is that overwork?
Look, I mean, that could be part of the picture, especially in healthcare workers with longer shifts and sudden changes in shifts and rostering because of COVID testing. I mean, frequent COVID tests and isolation until the results come in. But yeah, generally there's a great deal of fear that it's actually quite understandable given the situation, and given you only have to look at the amount of PPE that's being used in hospitals to see that there is a significant threat to health. So and people are responding to that in the best way they know, and one of those ways that they respond is indeed good problem solving. Unfortunately, the brain doesn't. If you're a good problem solver as a healthcare worker, your brain doesn't necessarily want to turn off at night, and so your frontal lobe is still very much activating and thinking of ways that you could stem potential harm coming up. in the days ahead or weeks ahead. So, it especially seems to hit good problem solvers, and that's something we'll talk about in a short while.
The importance of sleep is well established, and we remember back to, well, for me, even during clinical training as a doctor, you're taught that if you're not sleeping for 18 hours or more, it's almost like a level of intoxication, where you can't drink or drive, you can't coordinate, have executive function. And so, and what you're saying is, 48%, even pre-COVID, obviously reacting to pandemic and the world of uncertainty that we live in at the moment. But it feels like, Rose, that there are lots of other factors at play that perhaps has been contributing to sleep disturbances for Aussies for some time now. We live busier lives. There's more screen time and blue light associated with that, and we're trying to fit so much into our busy lives that perhaps I wonder whether sleep is a trade-off, and that's been taking an impact over the years.
Look, I think that's true. I mean, Matthew Walker and the neuroscientist was suggesting that 60 to 70% of people have a difficulty getting to sleep on at least one night a week, every week. And, so he's reporting on UK and American populations. And this is, in industrial societies, there is this pressure to, be productive, keep problem solving, just keep working, notwithstanding that our brain is readying us for sleep at night, and it is producing melatonin in a bid to try to help us get to sleep.
So how do you switch off if you're a problem solver who's still solving problems in your head involuntarily? How do you turn off at night?
Yeah, look, there are a lot of excellent sleep hygiene measures that help you with both sleep environment, like bed situation, the environment, the temperature, the noise level, the darkness level, and also lifestyle changes that can be conducive to sleep. And so there's a lot of pieces to that puzzle. And so one of the first things we check on when someone comes in with insomnia is just core sleep hygiene measures, how well they follow it. And if they're just not aware of these things, though that's very few people, most people are aware of sleep hygiene measures, we help them with sleep hygiene.
What would be your top 3 tips for a lot?
Yeah, so look, basically I'd say get up at the same time every day and get sunlight. There's nothing more reassuring for your brain to have a regular waking time, notwithstanding the quantity or quality of sleep. So even if you had a sleepless night, please try and get up at the same time and get sunlight. Sunlight is our circadian rhythm is the most the effective tool for re-synchronizing our sleep. 82% of our body's tissues has a circadian rhythm, according to Dr. Jan Dan Dijk over at Surrey University in the UK. We really are solar-powered creatures. We depend on the sun to not only stop our sleep in the morning, but also put us to sleep at night. So it's so important for our mood. If we get up at the same time and get sunlight each morning, it not only resets our circadian clock, but also resets our mood. And our serotonergic neurotransmission, our mood neurotransmitter, is optimized by getting that sunlight in the morning.
I love that term, being solar-powered creatures. I might use that for my kids when they want to stay up past their bed.
So apart from that, the second one would be, look, no naps during the day. What we want to try and do is increase the sleep pressure to what we call homeostatic sleep pressure, which is like a big wave of pressure building up during our waking hours during the day, that will then take us down pretty quickly into slow wave sleep or deep sleep within about 40 minutes at night. So if we have a substantial nap during the day that is over 30 minutes, then we may be borrowing some of that deep sleep from the night's sleep, because after we go past about the 30-minute mark, 40-minute mark with a nap, we go into deep sleep, and our brain just really wants to go through a whole cycle of sleep. So, and that's, you know, perhaps a 17 to 90-minute cycle, but you might find that your sleep onset that night is a bit later, or your sleep might be more fragmented if you go to bed at the same time and then get frustrated that you can't fall asleep on demand. So yeah, if you can, so not having naps during the day is definitely, if someone has insomnia, that's where we start. Getting up at the same time every morning, getting sunlight, no naps during the day. The final thing that I think is really important is just keeping our expectations realistic about sleep. I have people come in with Fitbits who are constantly looking at the graphing. There's even a word for this now called orthosomnia, which is correct sleep. And people, it involves people getting quite obsessive about the Fitbit data and trying to maximize their deep sleep. Now, deep sleep really is only about 13 to 23% of the night's sleep, and our brain regulates that beautifully, right? If we've had been awake for a sufficient number of hours during the day, our brain will, you know, prioritize getting that deep sleep. And it always happens at the beginning of the night, whether you fall asleep at 11 p.m. or 2 a.m. And our brain will ensure that we get the deep sleep we need if we give it enough opportunity. So we don't need to circumvent or control or, you know, maximize deep sleep. I mean, we don't actually have to have a part in it. Once we try to take control of our sleep, then we start up hypervigilance processes that kind of keep our attention on during the night and keep us looking in on our sleep.
So it's counterintuitive.
Oh, sorry, Saxon?
I was going to say, so it's counterintuitive. If you
Yeah,
get
that's
worked
right.
up about trying to get to sleep.
Yeah, the moment we try to step in and control it, thinking, well, my brain obviously can't do this very well, I'm going to step in and see what I can do to control it with either my own measures or, you know, checking in or medications. Then the moment we try to control it, we start to potentially start up performance anxiety about sleep. You know, it starts a hypervigilance process that can backfire by creating a need for us to control it more. And it starts to register in us a distrust of our brain's capacity to self-regulate sleep. And it just seems to be the most common thing that I'm seeing in people with insomnia. So we try to unwind that. Effectively, in the end, we're trying to get people to ignore their sleep, knowing that their brain will take care of it beautifully in the background.
That seems to be...
So we're our own worst enemies.
You could say that, just in terms of, look, especially if we're used to taking control in the work situation during the day, we're good problem solvers. We just, you know, why would the brain stop at night then? And especially if you take your work home and you're doing, and even more so if you're doing work activities in your bed environment, your brain will just say, well, you know, we just keep working during the night. That's what the frontal lobe does. Its job is to generate thoughts and problem solve.
So really practical tips. So regular time, get out during the day, don't take naps, you know, build up that sleep drive, that wave pressure, and make sure that you don't get too hung up on it, so you can relax both your mind as well as your body. And just for those that would be wondering about medications and perhaps even turning to alcohol as a sedative, I think the evidence, Rose, correct me if I'm wrong, is you don't get good quality sleep if you just sedate yourself.
Look, I mean, I see where people are going with it, and this is actually one of the barriers to improving sleep over time, because once people see the sedation that they have with alcohol, and to people, and also to medications, especially long-acting ones, where it really looks like they can sleep the whole night and it looks like they have no waking, which people with insomnia come to see as abnormal. And that's one of the myths that we talk about a little bit further on, because if if people grow to distrust that their brain can self-regulate sleep, and because it wakes during the night, and this is completely normal, most of the time we wake and we don't remember it. Good sleepers, they wake, they don't remember, they just remember sleeping all the night through. But if we come to distrust that and see that as normal, then we may try to blot out those waking times. And because if we have insomnia, we'll prime those and we'll see them as threatening and we'll remember them the next morning. So one of the things that medication in particular is good at, because it causes anterograde amnesia, is if we're talking benzodiazepine medications in particular, and also to a certain extent BZRAs or Z drugs like Stilnox and Imivane.
So these are the sleeping tablets that you can get, on prescription that patients might come see us for.
Yeah. One of the things they're really good at is disrupting the laying down of new memory so that you can't recall the waking periods during the night. Now, that's enormously relieving for people who fear waking periods during the night, so they want to have more of that. And so what happens is we get an attribution shift where we start to think along the lines of, well, my brain can't do sleep, but maybe the medications can. See, I have deep sleep all night on this medication, and that's what I've been yearning for, no waking periods. So it's the way we perceive it or we construe it for ourselves that really creates a lasting attribution shift that makes it very hard to come off medications and trust our own brain's processes in self-regulating sleep.
But it's a bit of an over-reliance.
Yeah, so that's right. I mean, so what we do is while we're doing an insomnia, CBT or cognitive behavior therapy treatment, we would be simultaneously seeking to start a very gradual tapering program so that someone can avert panic and slowly shift their attributions back to, yes, my brain does know what it's doing and it can self-regulate sleep.
It sounds like one of the messages is that we can treat it, we can improve insomnia, and as you say, some of these practical tips around lifestyle routines and behaviours can be put in place with the right supports. One question would be, Rose, what are the common barriers that you see or reasons why people fail to get improvements in their sleep? And how do we overcome these barriers? Yes.
Well, I mean, one thing that we all tend to do as part of the problem solving, of course, is what we call safety seeking actions that are meant to try and make the situation better and get us more sleep, but they end up making the situation worse. And one of the main ones is catching up on sleep in the morning. So I know how, if I didn't sleep until 3, then I'll just sleep until 11 a.m. because I need that 8 hours. And that means that another barrier is the perception that I must have 8 hours. And so that's what I mean about realistic sleep expectations. Your brain is quite okay about getting by without 8 hours every night. So, and normal sleep is a range, 7 to 9 hours and even a bit beyond that. There's a lot of people who feel very refreshed after 5 to 6 hours sleep. And there are age changes in this too. So if we can recognize that we don't need to catch up on sleep by just sleeping in longer, because your brain really wants to see that sunlight in the morning for, like I said, both its circadian clock and your mood. So also that idea of a resistance to getting up during the night if we can't sleep. And we all know what this is like because we've all at some point been tossing and turning and willing ourselves to get back to sleep, when in fact what we should be doing is getting out of bed, going to another room to give our central nervous system a chance to calm itself and just resetting. And what this allows us to do is to reassociate our bed with sleep instead of forming a conditioned association of our bed with wakefulness and frustration and anxiety and tossing and turning. Whatever you practice, you get good at in relation to conditioned associations. And if we condition a wakefulness and frustration association with our bed, it tends to keep going. And that's why people can't understand that after a period of stress is resolved, their sleeplessness keeps on going. But that is the conditioned association sort of cementing itself. And that's what we need to train out of. So
if you get up in the middle of the night and you go somewhere else, I'm assuming checking your phone is a bad idea. What about television?
Well,
what are you supposed to do? Is it have a cup of tea?
Yeah, that's good. You could do that. Herbal teas, or one thing that is quite nice for people is just having a cup of warm milk or something. Anything or a light snack can help people feel calm and feel like they're resetting, so they can go back and have another go at sleeping without trying. And the main criteria for going back to your bed is actually going to be sleepiness. It can't just be time-based. If you have any residual strong emotion we do not want that going back to the bed environment. So look, if one thing that's excellent for people getting out of bed, and I know over at Flinders University Sleep Centre, Michael Gradisar is experimenting with how far do you have to go away from the bed? Some people are actually able to read to get themselves back into sleep. They're very efficient at doing that. And that's extremely calming for us because, we have mastery, a sense of personal agency that I actually have some way to influence getting back into sleep. So one thing that's great about reading, say, either a Kindle or like a paperback, with a book light, is that it's a sustained narrative and you get to see your sleepiness cues come out again. So as you're reading your book, you might find yourself losing your place. And as you lose your place, that's probably going to be a micro sleep. Right. So 3 micro sleeps is an official entry for us back into our sleep. So we need to take notice of those micro sleeps when they happen, when our eyelids are getting heavy, when our head drops forward and we just notice and jerk back as we're, I must have been asleep there. And it makes us realize just how dangerous micro sleeps are on the freeway at 110 kilometers an hour, because we think we know we're about to fall into sleep, but we do not have a memory or awareness for the moment at which we fall asleep. That's why a micro sleep is so dangerous. But that's one of the things, the sleep cues that we're teaching people to notice at 2 a.m. when, they're out on the lounge and they're reading, and we're trying to say, okay, this is your cue for going back into bed again. You're starting to fall asleep. You've lost your place 3 times. Okay, let's go back into bed now.
You mentioned before not napping during the day. Is there any benefit to a 20-minute power nap?
Yeah, many people describe a 20-minute power nap as being enormously refreshing, and they have another burst of energy to keep working during the day. So that's fine. As long as you know that you're pretty good at kind of keeping to 20 minutes before it goes down into deep sleep, right? If you found that every time that you did it, it regularly turned into an hour and a half, then we're saying you've gone through a whole sleep cycle there, and you've probably borrowed from the night's sleep. Now, that's perfectly all right if you want to train sleep 1 and sleep 2, right? And, we're seeing in American colonial records now that people regularly did have sleep 1 and sleep 2 before the advent of electric light. So, people would fall asleep because they're producing melatonin a lot. Because they're producing melatonin, as soon as it gets dark, the sleep hormone, they would then fall asleep earlier, and then they'd be awake earlier during the night as well. So they might fall asleep from, say, 8 p.m. to 12 a.m. and then they'd get up, potter around for an hour or so, maybe even visit the neighbours. And then come back, and they'd have sleep 2 from maybe 1 to 2 a.m. until 5 a.m. and then they'd get up and feed, milk the cows. So Sleep 1 or sleep 2 is, it's said that before the advent of electric light, it's actually quite, a normal sleep pattern. And if everyone is doing this, then it's not a cause for distress. So sleep is eminently trainable. If we can train sleep 1 and sleep 2, and or we could train having a substantial nap in the afternoon and then going to bed later at night, like you could say the Italians and Spanish have done for a long time. Yeah, it's just about what you want to train.
Rosie,
what about sorry, Kev, you go.
Oh no, I was going to change the topic and talk about myths. So Rosie mentioned some myths are everyone needs to get 9 hours, and some people get hung up on and fixated on the amount, and others believe that you have to be in deep sleep the whole night, whereas in reality there's often some frequent wakings, and the trick is how do we help people get back to that sleep, so you drift in and out of light and deep sleep. What are some of the common myths that you see, and how do we dispel them?
Yeah, look, I mean, there's one of these is that sleep is to blame for all my tiredness, basically. I actually do a sort of pie graph of causes of my tiredness when people first come in, and pretty much it's 99% my poor sleep is to blame, for all my tiredness. Now, I am actually saying I've heard this from both pregnant women and with insomnia, and patients with MS and patients with autoimmune like issues and gut issues like Crohn's, all saying that they believe their sleep is the cause of their tiredness. So one of the things that we look at is a more nuanced picture of that. And we do a second pie graph of possible causes of my tiredness. And we definitely include poor or short sleep in that as one of the slices of the pie. But we're also interested in looking at what other things could be part of this picture. So it's not such a black and white or all or nothing picture with sleep as the culprit, because that's actually a hard one to get by. Many people will say, look, I don't even care about the number of hours I sleep now. I just don't want the tiredness, right? That's my holy grail. And tiredness is quite a difficult thing to improve if someone has labeled themselves as an ever tired individual. Like, I mean, there may be some really good medical reasons for their tiredness, and this is why we're one of the things we do is ask them to talk with their doctor about possible causes for tiredness that could be. I mean, if you look at the list of things, it's multitudinous. We're talking any heart, blood, lung issues, blood sugar issues, gut issues, autoimmune issues, pain, chronic pain issues, post-viral fatigue, viruses like Ross River virus, Q fever, Epstein-Barr. We're talking so many reasons for tiredness that if we do a semi-careful investigation of it, the person can find many nuanced reasons for tiredness. So they're less likely to put all the blame on sleep and try to fix that, and control it in a way that backfires. And Kevin, as a medical professional, I can imagine, it's a hard task because I'm sure you're aware of just how many medical issues involve tiredness, people's perceived tiredness.
Absolutely. We go through all the different reasons and try to exclude them, but as you say, I think that is a common understanding, which sleep can be an easy blame. And you put all the eggs into one basket and say, well, that's the issue. Whereas I think almost that mindset in itself becomes a barrier to thinking about other reasons, which are often quite fixable, or it's a passage of time if it's post-viral. But there needs to be almost like a slight mindset shift to being open to sleep being one of many factors, and then also sleep can be addressable and can be improved. I think that often is a critical part to getting people to understand, sleep hygiene and what are the different, and not just jumping to a sleeping tablet or alcohol.
Yeah.
One of the things we haven't spoken about is exercise. Does it help if you're keyed up after work or whatever you're doing, if you go and do some exercise and try and wear yourself out at the end of the day? Does that help?
Yeah. Actually, there've been a number of studies on that, because they thought that doing exercise early on, it was thought that exercise too late in the piece would then inhibit sleep, or you'd have too much adrenaline floating around the bloodstream, so it would be much more difficult to get to sleep. Now, a la Michael Jackson, who was actually doing quite rigorous dancing up until 1 a.m. and then wanted to be asleep at 1:30 a.m. But it also had to be said that this was an individual who was already very hypervigilant about his sleep and already using multiple substance measures to try to control it. So for the average person, if you don't actually have performance anxiety about sleep, and you don't have hypervigilance built up around it, then you could very well exercise quite late in the piece, maybe 9. It's all worth experimenting on, but do some 3 weeks of exercise at 9 p.m. and then see if your sleep is affected compared to doing your exercise at 10, finishing at 10 p.m. and seeing if your sleep onset is affected, because increasingly in a number of studies they're finding that it doesn't make a difference. The main thing that makes a difference is not having the performance anxiety about sleep and the sleep effort that creates more hypervigilance and threat appraisal. So look, I mean, and just alongside that, we all know of many people, many Europeans, for instance, who will have a coffee at 11 p.m. at night after dinner, and then they can fall asleep within half an hour. And this is something that suggests real confidence in their sleep. So, they just don't...
I can't do that.
Yeah, they just don't have performance anxiety about sleep, because and conversely, I have many people who are following all the sleep hygiene measures to a T, and they no longer drink caffeine, or their only drink of caffeine would be at 9 a.m. and then nothing further for the rest of the day. But they have severe performance anxiety about sleep, and they're in almost a panic state as they get to sleep at night, or they're going to bed at night. So it's more about the sleep effort, as Professor Colin Espy at Glasgow University's sleep clinic would describe it. Once you put in sleep effort, then suddenly the performance anxiety starts up.
So the best thing we can do is just relax and not worry about it.
Well, if we are worried about it, then there are certainly some excellent strategies that we can use to train ourselves out of that worry. Excellent ways of reframing, great ways of gathering evidence that disconfirms our fear about our brain not being able to self-regulate sleep. So there's a great deal we can do to help people with that.
I did want to ask Rose, who sleeps very well? Like, who's considered best practice in this area? Is it a certain age group? Are there certain cultures, like, as you say, the Spanish who take a siesta? Is it I grew up in the country, so, is it the farmer that just doesn't even think about sleep, but just works really well during the day, has a lot of outdoor time and, builds up that sleep wave? Or is it those that kind of, pays attention to it in the right way and gets help through your website or the Sleep Health Foundation? There's various apps, I suppose, like Sleepio, that can help people with their sleep, but tracking it in the right way. What are considered good practices here?
Yeah, well, it's an interesting question actually, because like just as you said, you know, because these people are getting, you know, they're out active in sunlight during the day. These are all the things that help our serotonergic neurotransmission, which all help us to, you know, because our pineal gland will use that serotonin to manufacture melatonin sleep hormone as soon as it gets dark. So theoretically, these people should have an excellent initiation into sleep. You know, it's very sleep conducive, those daytime activities. But we all know that there are high rates of depression in rural populations, and so what that of itself means is that there's going to be sleep difficulties, because insomnia and depressive illness is so comorbid. So I believe that it's less cultures in comparison, or it's less interculture than intra-culture difference or variability, because every country, every culture has good and struggling sleepers. It can relate to the personality characteristics of a person. If a person is more control oriented, they're more sort of doing versus being person. They're, you know, perfectionism and unrelenting standards. You know, when sleep is the one thing we cannot have perfectionism about, because as soon as we start trying to control it and, you know, perfect it, and then it gets worse, you know. Or become hypervigilant about it. So, you know, in every culture, urban and rural environments, disparate socioeconomic status, strata, you know, there are going to be people who can just value sleep and let it happen and ignore it, you know, and night by night they will see evidence that their brain knows exactly what it's doing. You know, once, you know, every 6 months or something, they might have a poor, you know, bad night's sleep, but they'll drift, you know, they just go past that, and it's not going to continue to worry them. So, you know, there are always people in any culture who value sleep and create enough opportunity for it. And there's always going to be people in every culture who overvalue sleep and become overprotective of it with excessive sleep effort. So I think that the hopeful thing to remember about this is, just as we can inadvertently train into insomnia, and it can happen to any of us if we have a period of, you know, high stress. And like I said, it can keep, you know, if it becomes conditioned during that period of high stress, it can keep rolling on after the stress is resolved. But I really would like to end with the note that just as we can inadvertently train into insomnia, we can learn about sleep and ultimately train ourselves out of insomnia with cognitive behavior therapy. The evidence is really strongly accumulated now that cognitive behavior therapy for insomnia works, and it does not take many sessions. We're just talking, you know, 4 to 6 sessions. If people are willing to do the homework tasks in reassociating their bed with sleep, then it will work. And this is even after 10 to 20 years of insomnia conditioning. So there's a lot to be optimistic about with sleep. And it's kind of hiding in plain sight, because the brain has always been there in the background, taking care of, you know, our circadian drive and our homeostatic drive. So, you know, it really unchanged from 40,000 years ago, when we didn't have medications like Restavit or, you know, or Valium or any of those sleep medications.
So there is hope and there's help if you do, you know, have sleep issues. There are ways to, you know, optimize your lifestyle and your routines every day to even prevent some of those issues in the first place. And you don't have to turn to, you know, medications or alcohol to get good sleep. I'm certainly one of those that, you know, can take my work home and think about what I need to do the next day. I just have very simple tips, like to write anything down that I meant to be focusing on the next day. If I'm worried about it and I'm in bed, if I write it down, I almost feel like I've at least parked it so I'm not going to
Excellent.
And
Excellent. Yes.
That kind of gives me a bit of a release, and then it often helps. Just simple things like that.
Excellent. Yeah, I mean, this is a really good idea, Kevin. This is just having a little notepad by the side of the bed and just writing some keywords on it. You don't even have to put the light on, you just keep your eyes closed and just pick up the pen and write a few keywords, because in the morning you look at those and most probably think, look, this is really a non-issue. But, I mean, if you think about how many times have we written notes and then thought, well, I don't even know why I was worrying about that. But, it really does help us to kind of, I talk to people about it as being like external storage. We just pop it into external storage and then, let's return to it in just a few hours, because I can't think lucidly about this at 2 a.m., but I can sure think lucidly about it at 6 a.m. I can problem solve it in 10 minutes at 6 a.m. and it's going to take me a whole hour now at 2 a.m. So what magic is going to happen at 2 a.m. now that I can't resolve at 6, So you can actually train worry, to 6 a.m. That's one of the things that we look at with worry training session.
Yep. Wonderful. Well, thank you so much, Rose. That was tremendous. Lots of great tips. Maybe we could just end on, would you like to share with listeners, your website, which is Let Sleep Happen, what resources you provide and where to turn to for help if those, are affected by their sleep?
Yeah, thanks. Look at the CBT website, Let Sleep Happen, has all the core evidence-based strategies that we use to help people at the Sydney Sleep Centre to overcome insomnia. There's lots to read about. You can read about any frequently asked questions that many people have about sleeping and waking, and about how to overcome insomnia. And it gives sorry.
That's okay.
I'm brain dead now. It's just a place to kind of do some core reading about the things that work in treating insomnia.
I didn't really know much about. I had a feeling about some things that worked for me, but it was great to hear it from you, and get a real understanding of what's going on there. I think that sort of helps relieve the anxiety a bit, is understanding what's going on.
Yeah, and that it's all kind of completely normal. The waking at night is normal, and it's only kind of our effortful responses to it that get us tied up in knots, unfortunately, because we do tend to overthink things as humans. So yeah, we can make things more complicated than they really are. So
we'll keep it simple. Okay, so with that, we'll wind up. So thank you again, Rose, and we'll be sort of promoting this with your website. So thanks again.
Thank you very much. Thanks, Kevin. Thanks, Saxon.
Thanks.